This is our cultural curated anesthesia on Hinduism. This is our scenario. Please press pause on the video now to read it before continuing. These are the topics we'll cover, so the belief systems, changes in beliefs over time, our anesthetic plan, misconceptions, and how they impact care. So these are some common themes found in Hinduism. Samsara is the idea of continuous cycle of life, death, and reincarnation. The Atman is the belief in a soul, the idea that all living things have a soul, and you want to reach salvation in order to end this cycle of reincarnation. Dharma is a code of living that embodies good morality. Karma, as we all know, is cause and effect. So the idea that the actions we perform in this life will impact our reincarnation in the next life. And then the caste system is a social hierarchy influenced by one's karma and dharma, or so it is believed. So essentially where you're born into the caste system was because of the actions of your previous life. So our cultural belief systems, there's an idea that multiple deities exist in Hinduism, but there's a belief in just one supreme being that's known as Brahman. Underneath Brahman are different deities. An example is Shiva. Shiva's the destroyer. So Shiva is a god that recreates the earth so it may be destroyed, which again speaks to the theme of reincarnation, being rebuilt, being broken back down, and doing it again. All right, so this is just sort of speaking to the timeline of Hinduism and how medical ethos have changed with it over time. So Hinduism is the oldest practiced religion in the world. In the 2000 BC, the Harappa culture, they valued good hygiene, good sanitation, weren't really practicing modern medicine by that point. You move about 500 to 1,000 years into the future and you catch the Vedic period. This period is really supernatural, and magico-religious sorcery, witchcraft is practiced. But it also included methods for surgery, treating hemorrhage, bone setting, and the use of herbs. So as Buddhism came into the area and influenced Hinduism, there was a shift from the supernatural to a more rational approach to medicine. So you get into the modern period, which is the Ayurveda. They prioritize curing disease while preserving quality of life. So there's 8 medical topics surrounding the Ayurveda, which is internal medicine, surgery, disease of the supraclavicle area, peds, OBGYN, toxicology, psychiatry, rejuvenation, knowledge for increased virility. So I've just included a couple here. So this period is really holistic. It views the body and soul as one rather than multiple systems. Healing is meant to be very natural. It's medicine's preventative rather than curative. And the karma is influenced because health and disease are sometimes viewed as consequences of one's actions. And there's an emphasis on individual responsibility for your actions as it's influenced in medical care. So we look at the belief and practice impacts on care for pain. Pain in Hinduism is very different from how we see pain in our culture. It's something that's embraced as part of spiritual progression, and patients frequently refuse drugs for spiritual enrichment. Prayer is a big modality to cope with pain behind medication. So pain is often perceived as a consequence from the past life and therefore self-inflicted. So it goes back to that karma and the individual's responsibility they place upon themselves. Pain is also seen as something that can be overcome with realizing Brahman. And labor analgesia is an interesting topic. So we think about epidurals, treating that pain, treating that labor pain. But with the Hindu culture, it's not always, like we said, pharmaceuticals aren't always the answer. So there's a lot of other holistic treatments that include breathing exercises, yoga, meditation, and just those approaches that are non-pharmaceutical. So this is the belief and practice impacts on care for perception. This is a study out of India that included 200 antenatal women, and these are just some of the stats they found. So they found that about 91% of these women didn't even realize the option to receive analgesia was available to them, which means it's probably not being explained very well by the anesthesia providers. 73% refused a C-section once they were explained, and then 46% of them refused it because they were afraid it would delay them getting back to work. Let's see, 70% of women stated their expected pain level to be 4 or less out of a 10, and that's without even understanding their analgesia options. So it seems like there's maybe some misconceptions about laboring pain. Only 46 out of the 200, which is 23%, accepted any analgesia during their labor. The study also found that women with graduate level education were prone to being aware of the options and more open to the C-section, more so than those with lower levels of education. And 65% of these women agreed to just leave the anesthetic choice up to their physician, which signals a sort of lack of empowerment, I would think, by the anesthesia providers. In developing countries, pain is viewed as bonding experience with the baby, and that certainly seems to align in Hinduism. Pain is, again, viewed as something that's spiritually enriching, and something that must be suffered through, worked through, in order to sort of pay the sins from your previous life. So these are just some of the assumptions and misconceptions of Hinduism. There's a conception that all Hindus are vegetarians. It's actually about a third of Hindus are vegetarians, which does make up about 300 to 350 million vegetarians in the world, which is a pretty impressive number, but only 30%. There's an idea that Hindu practitioners worship cows. It's not true. They're just very respected and revered in Hindu culture, not worshipped. The notion that Hindu women wear a bindi, which is the colorful dot on the forehead, for marriage. It used to previously be that way, but that practice changed over time, and now it can represent a number of different occasions. And the last one, there's the notion that Hinduism is about as old as Judaism. Hinduism is actually, like I said earlier, the oldest practiced religion in the world, with its origins dating back to 4000 BC. All right, so this is our anesthesia care plan. So initially, we want to acknowledge the beliefs of the laboring mother and her mother. So the belief that punishment is necessary for the patient may stem from believing that an ill deed was performed in their past life. We want to read the room and assess whether or not it's appropriate to ask the mother to leave in order to speak with the patient alone. We want to educate both of them on all the available options for analgesia. As we learned earlier from that study, analgesia options are not always explained to their fullest extent and pretty misunderstood in Hindu culture. So that's something we want to make sure we go out of our way to do. We want to use a lot of eye contact, speaking directly with the patient, even though the mother's in the room and speaking for her. Still want to give her the autonomy of being addressed. If labor analgesia is refused by the patient, then we'll proceed with more of those holistic Ayurvedic options, such as yoga, the breathing exercises, and the meditation we spoke about earlier. We want to embrace their belief system, accepting and encouraging them as they go through labor, and certainly to push our biases and our thoughts on how a laboring mother should not experience analgesia. More steps to our plan. So we want to involve decision making. We want to include the family in any decision making as long as the patient desires it. and ensure that they want the family involved. We need informed consent. There are some medications that may not be suitable for Hindi patients if they are derived from cows, pigs, horses, rabbits, or other animals. So we need to discuss that with them. And modesty. If it's requested by the patient, we need to make all necessary attempts to provide the same sex provider and discuss removing sacred clothing or threads prior to any procedures, such as when to remove and how to remove them. Additionally, we want to emphasize hygiene. Hygiene practices can be very, very important to Hindi culture. As I said earlier, they've been practiced since 2000 BC, so we need to discuss when it is appropriate to brush teeth immediately after waking from the anesthesia. Pain management, like we said, pain is spiritually enriching, so suppressing pain might not always be the best method for the Hindi patient. That's something we would discuss and have pain goals with our patient, have something realistic in mind. And fasting. Fasting is a big part of Hindu culture, and it's possible that the patient is dehydrated if they've been fasting prior to the surgery. So we need to clarify that timeline. If they have fasted, how long they fasted, and then probably do some preloading and co-loading. So the translation of care to non-Hindu patients. We want to treat every patient with the respect and remain judgment-free, of course. Keep an open mind to different ideologies. You never know what the driving forces are in a patient's decision-making process. Always want to inform the patients, give lots of options, from the least to the most, whatever is available to them, they should be aware of. The idea that verbal anesthesia is an anesthesia failure is just not true. We got to use calm tone, reassurance, breathing exercises, and yoga. When we're in the OR, we're, the experts on anesthesia, and so it's the words we say and the way we say them are impactful in terms of anesthetic impact. And then the cultural, traditional way is not always the best choice for every patient, of course. So, you think about hearing how it's always done, the way we've always done it here, which I'm sure we've all heard. That excuse is just not good enough. So the common way is not always the correct way for every patient every time. I want to tailor the anesthetic plan to the individual, including their cultural preferences. This is our references slide and completes the slideshow. Thank you for watching.